Hello and welcome back to my channel. For those of you that are tuning in for the first time, my name is Erik Schabert. I'm a doctor of osteopathic medicine with more than a decade's experience in family medicine and osteopathic manipulative medicine. And first off, I want to thank all of you who have tuned in previously and are coming back now. Your continued support is very encouraging to me in my ongoing efforts to develop this channel and make it a community resource. For those of you that are tuning in for the first time, please do remember to like, share, and subscribe to this channel, as doing so helps me get it out to more people. All right, today I want to discuss one of the more common over-the-counter drugs in the US today, something that has been regularly used in the United States for decades, and that's Benadryl, or its generic equivalent, diphenhydramine. I'm going to refer to it as diphenhydramine throughout the rest of this video because it's a component drug in a lot of common over-the-counter medications, and knowing it by that generic allows you to identify it and be aware of when you're consuming it. A group called the Consumer Healthcare Products Association posted a review earlier this week. This group is a industry-led, industry-funded consumer watchdog association. And their lead author, Dr. James Clark, a department head at Johns Hopkins University School of Medicine, one of the most prestigious medical schools in the country, came out with a review questioning the continued use of Benadryl because of safety concerns. The reason for these concerns is the potential for sedation, cognitive impairment, heart rhythm issues, including fatal arrhythmias, and dementia risk with long-term use. Benadryl, or diphenhydramine, is what we call an H1 receptor blocker, meaning it blocks the action at certain histamine receptors of the histamine neurotransmitter. This has significant effects in the immune system, and it can also lead to central nervous system sedation, which is one of the concerns we have here. It also has an ancillary effect, really more of a side effect, where it blocks the action of a neurotransmitter called acetylcholine. Drugs that do this we call anticholinergics, and there was a study published in February showing that any drug with anticholinergic action can increase the risk for dementia with repeated use throughout life. And it's a risk that is truly exposure dependent. And what that means is the more doses of diphenhydramine you take, the greater your risk for dementia going forward. Okay, so all of those are quite concerning. Well, we have an additional problem with diphenhydramine, and that is it can take a long time to clear the body, and that time increases the older you get. For elderly people, it can take as much as 18 hours to fully metabolize the drug and get it out, and yet its effect is only for 4 to 6 hours. And what studies have found is that this can frequently lead to overdosing in older individuals who are not aware of this and use the drug regularly. Because if you're taking it every 4 to 6 hours, but it's taking 18 hours to get out of your system, it can build up, build up, build up, and build up. And even though it's not having therapeutic action, it can still have very serious side effects. Okay, so the side effects manifest in a multitude of different forms. And these can include agitation, extreme sedation, including coma, and in some cases even death. Usually when death occurs, it relates to cardiac toxicity, which can occur with ever-increasing levels. This medication was also recently responsible for several child hospitalizations and fatalities during the viral Benadryl challenge on TikTok. Of course, we should be educating our children not to blindly engage in some of these challenges that come up on social media, but it can still happen, and we definitely want to restrict access to substances that can be used in this way whenever possible. As I mentioned previously, diphenhydramine is present in a multitude of over-the-counter drugs, including Tylenol PM and other sleep aids, as well as a lot of common combination cold medications. Safer alternatives for diphenhydramine are present for just about every indication for the drug. When we're talking about cold and allergies, medications like Claritin, Zyrtec, and Allegra, and their generic equivalents, loratadine, cetirizine, and fexofenadine, are far safer. They have longer durations of action, are every bit as effective, and don't have any of the central nervous system related toxicities of diphenhydramine because they don't cross into the brain. When it comes to sleep, a supplement like melatonin or valerian root is a safer alternative. It's also much safer if you want to pursue cognitive behavioral therapy and good sleep hygiene. And these can be every bit as effective long-term as using diphenhydramine for sleep. For anxiety, there are many safer prescription options. And although there aren't really proven over-the-counter options available, going to a doctor and seeking out one of these prescriptions is a far safer way to deal with anxiety than using diphenhydramine or another antihistamine medication. All right, that wraps what I have on diphenhydramine and Benadryl today. I am going to link to a CNN article that has a really good description of all of this in my pinned comments. Thanks again for tuning in. Please do take this to your doctor if you are using diphenhydramine regularly and need guidance on an alternative that wasn't presented here. Thank you so much, and I'll see you next time.